Los primeros síntomas que vi, los más leves, fueron sudoraciones y sentía como malestar de gripe. Yo empecé como que ahí algo está pasando, algo no está bien aquí.
Just months after arriving in the US, asylum seeker Fernando Ermita was diagnosed with HIV on New Year's Day in 2022.
Yo sentía en ese momento, dije, no, me voy a morir realmente. O sea, ya mi vida se terminó.
Ermita needs lifelong access to antiretroviral therapy to stay alive, and has sought care in multiple states, including in North Carolina. But he says finding care has been a struggle in a system filled with linguistic, cultural, and bureaucratic barriers.
No sé si realmente es Carolina del Norte o es el sistema de este país, no sé realmente, pero es algo que me preocupa constantemente, la situación de mi medicamento.
The most recent federal data shows rates of new HIV infections for Latinos are dropping slower than for other racial and ethnic groups. The federal government is putting money specifically towards places with high rates. But a KFF Health News and Associated Press analysis found more than half of these areas still saw diagnosis rates increase for Latinos while decreasing for everyone else.
From a policy point of view, what's most striking is that as a community, Latinos remain largely invisible. So our HIV prevention and treatment needs, they're not being elevated to the point where we can ensure that the strong and very effective tools that we have for prevention and treatment are reaching our communities. There are some geographic spaces where Latinos face more challenges. That's particularly true in places like the South. There may be more restrictions in terms of who can get care and how Latinos can access that care, fewer healthcare providers that are actually trained and able to provide care to the Latino community in Spanish and in ways that are culturally acceptable.
Ermita thought leaving the free clinic where he was getting care and buying marketplace insurance would make things easier. But this came with a costly copay.
Me encontré la brillante sorpresa de que tengo que pagar $1,275. Yo me iba a morir. Cuando yo vi eso, fue caótico.
Ermita went 2 weeks without his meds. That's when he and his fiancée began preparing to move out of state in hopes of finding better care. Since April, Ermita has been commuting 8 hours each way to a clinic he found in Orlando, but he has mixed feelings about eventually leaving North Carolina for good.
Realmente sí, me siento muy triste, o sea, tengo como ganas de llorar, de gritar, de decir, bueno, ¿por qué siempre me toca como que dejar algo que amo tanto? Pero bueno, como me comenta mi prometido y mis familiares, que yo tengo que estar donde me den buenos servicios médicos. Esa es mi prioridad. Lo demás es secundario.
Fernando.
Hola de nuevo, Lisa.
¿Cómo está? ¿Todo bien?
Pineapple Healthcare is at the core a low-cost clinic, no cost for people living with HIV or accessing prevention.
So that means you're going to be done with the provider as soon as possible.
Pineapple Healthcare focuses on the queer Latinx community, and that is because we are built for and by the queer Latinx community.
When care is culturally and linguistically competent for our community, we actually use it and we benefit from it, and it helps us to have the same outcomes that others have achieved in terms of improvements.
For now, at least, Ermita is optimistic that his search for care is at an end and hopes to live a long and healthy life with his fiancé, friends, and family.
No quiero morirme y creo que de VIH no voy a morir de viejito.